Hi, I'm Dr. Swati Kanakia. I'm a pediatric hematologist oncologist from Mumbai. This video is a part of an initiative to help parents who have children with cancer. This video is not meant to replace your doctor, so please consult your clinic and doctor at all times. Over the last so many years, 2 decades in fact, the commonest question I have been asked is, Doctor, my child is going to receive chemotherapy. Will he or she have hair loss? And the answer is yes. Most children experience hair fall, but the good news is that it is temporary. Some of them will have complete loss of hair and they go bald. Some of them will have just thinning of hair, but definitely there will be some effect on the hair. Not just the hair on the scalp, but on the eyelashes, eyebrows, as well as body hair. They may all, there may be hair loss at all these areas. So, when does the hair start falling after chemotherapy? It is around 2 to 3 weeks after the medicines start, and of course, it would depend upon the chemo schedule, like how quickly you are going to give the cycles, and it will also depend upon which drugs are being used as part of the chemotherapy schedule. The next question is, Madam, what can we do? And the answer is, well, nothing really. There is some talk about using cooling caps, but we really don't have much evidence which suggests that it is very effective, or we really don't know either its effects or side effects. Of course, there's a lot of work and research going on into different types and computer controlled cooling caps, but no evidence as far as its usefulness as of now. One of the mothers, she actually came and asked me, Doctor, I really need your help. There is no problem about the blood collection, about the medicines, but the child refuses to go to school. She doesn't, she's not happy. There will be friends who will ask the child, and she's just at home all day, doesn't want to play with friends. So, what can I do? The answer is, first, you as a parent talk to your doctor and first decrease your own anxiety. After that, you start talking to your child. Explain to the child that this is a temporary thing and it will 100% come back. I've had patients, especially one of them, who was an acute leukemia when she was 3 years old, and now she is a model. And of course, we know of so many actresses as well who are who have very good hair despite having had chemotherapy in the past. So please, you remember and tell the child that this is temporary and it is going to go away. Make the child meet other children at the chemotherapy center or at the clinic where they are also recovering from hair loss, so that the child will be reassured that no, I'm definitely going to get my hair back. Sometimes some families also decide to go bald, but I'm not sure that it works in all settings. We also advise children to wear bandanas, to wear caps, hats. They could also get a wig, and these are very easily available everywhere. So, any of these methods can be used to help your child cope up with the hair loss. What steps can you take during the hair fall? Some children like to trim or shave their hair even before there is hair fall. And of course, you ask them to wear caps. During the hair fall, sometimes it falls out in tufts, like a large amount of hair. Sometimes there is a generalized thinning. So it depends from patient to patient. But irrespective, everyone should wash their child's hair very gently. Use a baby shampoo. Don't use a hair dryer. Preferable to use a towel and gently pat the hair. If you're using a comb, use a wide toothed comb so that the hair doesn't pull while combing, or use a soft brush or a baby, you get baby hair brushes as well. You could use that. Avoid using rubber bands and clips especially those that will get stuck in the hair, and when you take it out, it will pull out the hair as well. So you could, just avoid these things, and there will be lesser, hopefully, lesser hair fall. Again, I cannot tell you the importance of just talking to the child, explaining to the child what's going to happen and when the child is likely to recover. Also, educate the child as to how to answer questions if they are asked. Okay, sometimes the child gets very embarrassed that I don't have hair, and there are school children who are staring at them. So take the child's friends into your confidence, in your confidence, and tell them to help the child, and this will really look after a lot of the child's problems. Uh, Before I end, I have to tell you that it is conventional, or it's traditional in India to use coconut oil. So a lot of parents ask me, can we use coconut oil? Well, there's nothing wrong in using it, provided you wash it off. We don't want to leave the coconut oil on the scalp along with the sweat and then cause infections or irritation on the scalp. So you could use it if you feel no real evidence to say that yes, it works. But definitely, if at all you use it, please wash it off. Thank you very much for watching this video. Also, remember to consult your doctor at all times. This is not meant to be medical advice. If you have any other tips or tricks about how to deal with hair loss, please do write into me in the comment section, and I will include it in the next video. Who knows, it might help another child as well. Thank you so much.